Good evening. Joining us at Hyde Park tonight, we have with us the Deputy Director General of Public Health, Dr. Paba Palihawadana, who will be talking to us about COVID-19, Sri Lanka's efforts to curb an outbreak and pandemic that is spreading across the world, and how Sri Lanka is working and the efforts put on by the public health authorities to mitigate its effects here in Sri Lanka. Dr. Palihawadana, good evening and a warm welcome to Hyde Park.
Good evening.
Epidemiology is one part of the 10 areas of public health that you're overseeing, and we thought it would be timely for you to talk to us about COVID-19. Yes, we are more familiar with COVID-19. It was initially novel coronavirus. Nobody knew what it was. A new virus that took the scientific and health world by surprise and shock. People knew very little. And here we are with somewhat understanding of what this virus is and what damage it has done. But let's focus on Sri Lanka. Where do we stand now? How should we analyze Sri Lanka's situation?
Yeah. So the Sri Lankan situation, and as we all know, that we have been having cases since mid-March, and then of course now we have about 103 cases reported all together, and from all over Sri Lanka, and mainly the 3 districts have been affected more than the rest of the districts. It's the western province has been affected more than the others, and all, like, the majority of them were men, which is the 2/3 of them were men, and also the age group, the affected age group was around 35 to 45, something like that. So that is the age group that is mostly affected. So that's the basic epidemiology of COVID infection in Sri Lanka. And as you asked, how, what would be the progress? And so, the thing is this, now it is, of course, it is the beginning of the outbreak. And of course, we have been able to manage at a certain point where we see a number of cases, about 10 to 13 per day, like sometimes it was less. And yesterday we did not have a single case, and today also so far we did not have a positive case yet. But anyway, we were able to maintaining at a lower level of cases. And so incidence, if you talk about the incidence of novel coronavirus cases in Sri Lanka, of course we have been able to and our curve is of course almost flattened, and it's going down at the moment. So so far we have been able to handle the number of suspected patients, and also the number of patients who have been treated at the hospital and all. So right now, if I answer your question, of course, it's not a kind of massive kind of an outbreak right now we are facing.
As you mentioned about flattening the curve, probably the most heard word around the world. But here in Sri Lanka, we heard the Government Medical Officers Association speaking to the general public yesterday via a media briefing to say, if you do not pay heed to government regulations put by the health authorities, the virus could peak around April 7th. But this is quite alarming.
The thing is this, of course, all these what we have achieved, of course, based on the public health measures. Amount of public health measures have been applied, and then percentage of people who have been adopted. So that's how the success story would come in. So then we may not be able to say exactly what is the percentage of people are practicing what we are talking about. So we are talking about 3 main preventive measures: hand hygiene, the cough etiquette, and the social distancing. So many measures have been taken by the government as well as by the public health authorities based on the advice of the public health authorities. Right. So that's why now at this juncture we are having curfew in certain districts, and also in certain districts we have lifted, and again we have imposed. So likewise we are identifying the worst districts and trying to be strict on applying those principles of prevention of the disease. And as you said that there are about now, the thing is this, if you don't do anything, so each case can produce 2.5 to 3.5 cases. So we'll say 3 cases per case. If we allow it to happen, of course we may be ended up in hundreds, thousands, 10,000, something like that. So that is if we are not practicing, or we are not adopting the precautions and the guidelines have been provided by the public health authorities. So for that, the public health authorities are really having a huge mechanism on the ground, which people don't know about it. So once a case has been identified, a case has been become positive by the laboratory, this information goes to the central epidemiology unit, and the epidemiology unit informs the district level people and to the ground level. So then the medical officer of health and the PHI would visit each and every case, or the contact of the case. It's not the case, of course, the contact of the case, and then they are advising what to be done. And always there's a continuous dialogue is going between these two groups of people.
But there has been, we've heard about difficulties where people have not divulged information, and this is a massive hindrance to efforts by the health authorities.
So that is, again, we have a tracing mechanism from the airport. If they have reached the country, if they have returned to the country within last 14 days, of course, then we have the information coming from the airport as well. So that information is also being gathered at the central epidemiology unit. So there are two ways of screening. So now those who have come from those countries, whatever the country, and are being screened at the grassroots levels. And at the same time, we have another mechanism where all contacts of these cases are being followed up. So that there are two mechanisms going on at the same time by the public health authorities.
But what of those who have evaded screening and any
so
any
then
measures?
We also get the message from the neighborhood. So there is another mechanism where we get this information from the neighborhood. They give telephone calls, police, and also from the National Intelligence Service. So like now we have different mechanisms to identify if someone has come from another country or those who have had contacts with foreign international individuals. So then this information could be gathered at our point at the central level, and we can start tracing. There can be instances where people give wrong addresses, the wrong telephone numbers, and trying to hide. But all those people who have, played the games also have been caught up by the police.
But why are they trying to play the games? Is it because they're scared, there's fear surrounding this, or is it because we haven't given the message about coronavirus, we haven't told them that there's nothing to fear about it, you just have to be in quarantine?
I think we always talk about it. I think we always say that you don't have to get panic about this, and this is a respiratory infection. What you have to do is if you get some symptoms of the disease, maybe the cough, fever, and the respiratory infection, symptoms of respiratory infection, kindly inform the public health authorities and then go to a hospital. But I think the thing is there's nothing to hide. So because this is just a respiratory infection, there's no stigma attached to this.
But there was a stigma surrounding this this virus at the beginning when it was first introduced and spoken of in the media and across the world. So we in Sri Lanka too, we saw cases where certain people could not walk out into markets. But do you think health authorities have done enough to address this situation?
So I think health authorities are also doing quite a lot. So there may be a small percentage of people who may not listen even to the police, right? So I mean, these things of course happen in any part of the world, but the large majority of course were quite positive. And that is what we have observed, so, last couple of days when they lift the curfew and how they've been behaving, and at the same time there may be a small percentage of people who may have not behaved the way that we wanted. But the thing is like the authorities, of course, always they do talks. I mean, all media channels, and as you said that, I mean, this is open for corona, right? It's not only there, and even all the other channels and the major media is working for corona or COVID-19. So therefore, I think the enough information is being sent by all these media personnel. Plus, they also can read and learn. And I mean, Sri Lankan population is quite literate. They should be able to read and learn. And also at the same time to learn the correct facts. And that is the most important thing. And you should be intelligent enough to read and understand and then do what you are supposed to do. So which of course it's a kind of battle between the public health authorities and the people. I mean, I won't say it's a battle, but this kind of
it's a challenge.
It's a challenge.
It's a challenge. But we do see, as I said, as you said too, security forces personnel, the military health authorities, they work around the clock. It's heartening to see how much of an effort they're putting into this to make sure that our public, our communities are safe. But again, the advice that you give is quite simple, that we could practice at home. Wash your hands, ensure basic sanitation. But why is it that this does not go into our heads?
I think the majority of people have understood, and I'm sure even for those who have been quarantined at the centers, as well as self-quarantining, what they did at their own houses. But majority were practicing, of course. There's very few people have misbehaved, right? So, and I think, and also at the same time, the society also should understand their responsibility. What about the individual responsibility of listening to the government sources, the health authorities, and to comply with whatever the advice that is being given? I think that also, I mean, I don't know whether Sri Lanka, we don't have that culture of listening. But the thing is, I think when there is a disease, when there is an outbreak, and this is causing quite a number of morbidity and mortality. We know that the number of deaths that have taken place. We can't, I mean, take it simple also. And also, we don't want our people to be put into the trouble.
The situation in Europe is critical.
It's so bad in Italy and in many other European countries. They have not been able to control it properly. So then, therefore, we also have an elderly population. Since Sri Lanka is quite a lot of large percentage of people are elderly. So right. So if we get the disease spreading into the community, there will be a whole lot of elderly people can get the infection and they can even die. So therefore, this is not just something so simple as that, but it could be prevented at the same time.
Right. We'll talk about how we can look into that aspects of prevention after this short break at HydePark. Just stay with us. Welcome back. You're joining us at HydePark, and we're talking to Dr. Paba Palihawadana, Deputy Director of Public Health. Dr. Palihawadana, you were talking about prevention measures, but at the beginning of our discussion, you did mention about the epidemiology of COVID-19 in Sri Lanka. You said mostly men have been affected. But if we go more into detail, let's talk about, what kind of, how they are, whether the age group, you said mostly up to 45, 40 to 50. Yeah. But again, are they already immunocompromised? Those who have weakened immunity, or do they have other non-communicable diseases? Because there is a fear surrounding COVID-19 that mostly those who have kidney disease or diabetes will be first affected. But if you give us some clarity into this.
And yeah, so as I said, so the mostly affected age group is between 40 to 50. And as far as the younger age group, of course, we don't consider them as old age groups. Of course, we consider above 60 years of age, of course, they are more prone to infections, plus they may get the severe infection. So they may go into complications. I mean, that is how it's been decided. As you said, that diabetes, the kidney disease, those who have chronic lung disease, of course, they are the people who can go into complications. So many people would end up with the disease within a shorter period of time with milder symptoms like cough and fever and respiratory symptoms. But the percentage who are going into sort of pneumonia and further, maybe the respiratory distress syndrome and septic shock and all. So the majority in other countries were the elderly people, those who have had complications also, added comorbidity, as you said, the chronic illnesses. So in our country, sort of, we have not observed many among older age groups. And so far, the patients we have, of course, they're quite stable. Most of them are very stable. And yes, the percentage above 60 was around 10%, which is quite low. And 33%, 1/3 of them were between 40 to 50. So, I mean, that's the epidemiology in our country. So, it's probably that these people were the people who came from other countries, Sri Lankan returnees who came from Italy and other countries. So, they were, of course, in the working productive age group. So, that is why we see the most of them were between 40 to 50. Right. So, then after they have come, they have infected few older people in our country. So, I mean, that's how we have observed it.
Very
few older people, above 50, have also got the infection from other countries and have become positive here. So we have these kind of, 103 cases where, like, we know from where they have come and what are the age group and etc. Because below 10 it was less than 5%.
COVID-19 in Sri Lanka is not at community spread stage, which is a great achievement in terms of efforts put together by Sri Lankan authorities. But you did mention, if you do not allow this to spread, if you do not, you stressed on it. Let's talk a little about this, about the preventive measures, because we've been talking about social distancing, and this has led to a lot of complications. Curfew is imposed, but yes, it's a difficult period, but this is done for the greater good of the people, to ensure that people are distanced at every level. But there are other economic issues emanating as a result, which cannot be prevented. But let's stress on this, because I think our viewers and our people will need some assurance from you about the measures that are taken.
Yes. And I think, it is the most important thing to practice right now, because the hand washing and things, of course you can do it at home because you're not traveling here and there, so I mean easily you could have clean hands, and also the cough etiquette is the same again, so you can practice. It's not so difficult, but the social distance, even if so there may be instances where you have to, for example, that when you had to buy certain essential stuff from the various grocery departments, so I have observed on air, like people were gathered and they were trying to grab things, and they've forgotten about what they were doing, and they've forgotten about the social distancing, which we always say that at least keep 1 meter away from the other person. Yes, so for that, of course, I think we need to minimize that. So we discussed these aspects with the government at the task force level, and then we stressed the point that we need to devise a proper mechanism to provide food for people. They should not gather, or they should not go to crowded places and get themselves exposed. Right. So that is the thing that now we have highlighted yesterday, and also that from today now the government has made a decision to deliver foodstuff to the doorstep. So which will prevent people going and buying things and coming home. So we'll see whether this is going to work for us in Sri Lanka, and we'll see how it is being, how good is going to be, because there are various mechanisms that we need to do, but this is a new, this will never be, we have never done this kind of exercise.
But the spread of this virus is quite rapid, and it spreads fast, although the damage is less. If we talk about SARS a little, because we see similarities, I'll just mention the figures that I have here. Nearly 8,000 were infected, 774 killed.
So that the case fatality was around 4 to 5%?
Yes,
but 10%. It's 10%.
10%, but
for MERS it's even higher, 40%.
Right, but COVID-19 it's just 1 to 2%. Although it has taken just it has
shown
affected
higher mortality among older people.
Right. Older people,
and it has gone up to even 8%.
And in Italy, it's unprecedented.
Yes.
But here, that spread, that is what you're trying to curb. Again, to ask you that question, Doctor, I'd like to say, you mentioned about mild symptoms that we might. How do we understand this? This is something we keep talking to health authorities, but I think we need to know more in order to understand ourselves.
So usually the symptoms are the fever and a dry cough. So those are the most common symptoms that anyone would get. And then it may go into a kind of a productive cough, like with sputum and all. And also there may be respiratory symptoms, the runny nose and sore throat. And those are the symptoms that it's like a normal respiratory infection. Those are the symptoms that they also would get in COVID-19. So them may be more similar. May be very difficult to differentiate from a ordinary upper respiratory tract infection. So, but then the mild means that if someone is having difficulty in breathing and also that he is going into pneumonia, going into complication. So then if he cannot breathe, then he may be put into a ventilator, like he may need artificial respiration. That's the different stages that a person can go. But it's only a 5% of the people would go into those very severe complications. So which is, of course, this is, I mean, it can happen even in influenza or even in any other respiratory infection. So we all know about it. But the thing is, like as you said, this is not fast spreading, and again, because it will infect only 2 to 3 people, 2.5 to 3.5 people. So that means, like if you take measles and all, one patient can infect 15 to 18 individuals. So which is, of course, COVID is not so bad as SARS, as MERS, and
but
also it's not a fast
globally,
spread.
but thousands have been.
Yeah, that's because we don't have immunity, and it's a new disease, it's a new virus, and also now that is the reason why we see a kind of a huge pandemic all over the world. So,
right. We'll talk more, Doctor. Thank you very much. We'll take a short break and we'll return to speak with Dr. Paba Palihawadana at HydePark. Welcome back. Dr. Palihawadana, we were talking about COVID-19 prevention, but let's move on to research into a possible vaccine to address this pandemic and this virus, to contain it. There's a lot of talk about anti-malaria and Ebola drugs being effective in dealing with COVID-19, this pandemic. But in Sri Lanka, we spoke about not issuing such drugs without a prescription. Certain drugs and their names were given out to the media and were issued. Would you give us some perspective into this?
Yes. So of course, there are several drugs, of course, have been identified as effective against COVID-19. And chloroquine is one of them. Chloroquine is a drug that we've used in malaria. And Sri Lanka has been using it for years. And so now Sri Lanka is using chloroquine for patients who are positive for COVID-19. And that's the decision taken at the government level, the ministry level, to treat them with hydrochloroquine, because which is of course available with us, so which is not a problem for Sri Lanka to give chloroquine to patients with of positive.
But so that does not mean somebody, if they assume that they have mild symptoms, they could just walk to a pharmacy and then
no, it should not be the way. Always there should be a prescription to buy drugs. So people can't decide on their own, or the pharmacists cannot, decide on their own to give medicines to the people who are coming for, buying medicine, which of course has to go through a proper channel, and the doctor should see, and also he should think of this could be a case of COVID, and so then we do the testing, we want to confirm, and then we give medicines. Why are we giving some other drug or unnecessarily try to treat patients with chloroquine?
But we've requested our citizens also, if they do experience certain complications, mild maybe, or if they suspect, to stay at home, to remain in self-quarantine. So how does this work? When should they come to and seek medical advice? How should they seek some sort of treatment?
So now, what we have advised, if someone has developed cough or fever, having had associated with a kind of a foreign returnee from an international, I would say a tourist or a family member who have returned recently from overseas. So, and also you had kind of a contact with the person who also have had, some contacts with like those who have worked with tourists. So likewise. So these are the people who should think of whether I have got the disease of COVID-19 or not. So then they should always seek the medical advice. They should ask the local health authorities, and they would direct them for the hospitals for the treatment. So if someone just got a simple, cough and cold, still they can ask from the health authorities whether they should seek treatment. So we have the facilities at the Ministry of Health, the Health Promotion Bureau. So they have the hotline, so people can ask. Always they can ask, the doctors are answering the questions. So if they have some symptoms, of course they can clarify whether they should go quickly to a hospital and get the treatment for COVID, or whether they can stay at home for a couple of days and observe. and then seek the medical advice. I mean, that services have been provided and people have the access to ask those questions and verify. I mean, just because you just get a simple attack of respiratory infection, you are not supposed to run to the hospital, which you would, overload the hospital, and where the staff would get overburdened with, unnecessary patients who would come and trying to get admitted.
So and the risk of spreading the virus also, or if you don't have an infection, you might contract.
And the other thing, the most important thing is if you develop symptoms, first you must cover your face with a mask, and that will prevent others being infected in the same house, and also continue hand washing and also the cough etiquette. So, and the social distancing, and those are the most important things that we need to practice if someone has symptoms. And then you can keep distance from the rest of the family until you would get better, or if you want to get medical advice, you can do that.
The question of face masks, this has been a little confusing, but I know it's addressed at the moment. But yet, I think it's timely that we still address it and talk about face masks. Are face masks necessary or not? Because I have interviewed health personnel, experts, authorities here, and they've very categorically said no, masks are not necessary unless you have symptoms or you develop symptoms, just as you mentioned. But we do see that certain law enforcement authorities have requested or want the people to wear masks. If not, they're punished.
Yes, the thing is this, I mean, I would again reiterate the fact that we should not wear masks, in our day-to-day work or when you are going outside.
I'm sure both parties, all sides are doing this for the best interest of the people. But do we really need it or not?
No, we don't need it really right now, because there is no community transmission occurring in Sri Lanka right now. So people don't have to get panic about it. So, but the thing is this, now I said who are the people who should wear a mask, and also the healthcare workers and those who are involving taking care of patients, of course they also should wear. I mean, that's a different story.
Because they're at a constant risk.
But for people, the normal citizen, of course, the thing is this, now, I mean, in any country, this has happened to many other countries, we may run out of all these masks and all. But the masks are most needed for the healthcare staff. If we have faced a situation where we cannot get masks for the healthcare staff, so there will be a chaos that they may not be able to treat or take care of patients. And then there will be a big issue, so how are we going to provide them the adequate number of masks? Even if an individual who may be having a collection of masks, better to keep it at home rather than using it. But when the time comes, if it is really necessary, he may be able to wear it. So if you have a stock, please keep it with you. You can use it later. If there is a community-wide community transmission, then we will inform you when to wear a mask.
I think to talk more about that, we'll have to return after this short commercial break. Welcome back. We see disinfectants being used in order to ensure that the spread of COVID-19 is contained. But how can we look at this in a widespread manner across the country, Doctor? Is there something that you prescribe that health authorities believe is essential at this stage for the country?
I mean, it depends on the place where we are going to disinfect. Hospitals, of course, they need. So that has to be done daily, or maybe even 2-3 times a day, depending on the activity, what has taken place. I mean, any procedure done, so that they may have to clean the entire the place, the floor and the walls and etc. and the surfaces and all, and the instruments. But for in general, so your house, if you are kind of if you in your own house, if you want to clean, I mean, that is your usual mopping and cleaning of the windows and the glasses. Whatever you have been using so far, it could be used. Then you don't have to worry about those things. You don't have to buy any disinfectants for that. Soap and water is good enough. Even for hand washing, we are recommending soap and water would be the best. If you don't have water and soap, then only you use hand sanitizer. If someone is having to do it very frequently, you may not be able to find water and soap, so then better to have hand sanitizer. So then for the kind of, public places, I mean, everyone is trying to spray, and so which, of course, I mean, for me, I don't think it's quite advisable to, spray on the roads but for public places, the officers, then what, like anywhere, maybe what are the other places? Okay, those are the two places that comes to my mind.
Right.
So that you could clean, so you can mop. So again, you can clean the walls and the surfaces. 70% alcohol-based any disinfectant could be used for the surfaces, and also for the railings and the kind of doorknobs and etc. could be cleaned. And the floor, of course, you can use the soap and water. And so that's those. I mean, that kind of a cleaning is good enough. And these spraying along the roads and things, of course, I don't know how much that you could do for the entire country. You're trying to load with different disinfectants, onto the drains, but for workplaces and the public places, if they clean, of course, that's a good thing.
Right.
Like, all these public transports and also now at least the dust have been removed. So, I mean, that's a good thing that I look at it very positively. But when they start cleaning and washing, but loading with disinfectants is not going to
not
work.
recommended. Is not some. But let's talk a little, because these are the final few minutes of our program. I'd like to address the question of pregnant mothers and the anxiety surrounding already complications that they have and the fears of COVID-19, an unknown virus, and this could be quite overwhelming for them.
Yeah. So for pregnant mothers, of course, if they develop any symptom suggestive of COVID, and they would inform the area public health midwife first, and they should not move around, and especially these days should stay at home. If they have someone in the family who has been infected or any respiratory infection, try to be keep away from that person, and that kind of measures she should adapt, hand washing and social distancing, and those things are applicable to anybody, any person. And for them specifically, they should inform if they have some symptoms of respiratory symptoms, inform the public health midwife and the MOH, the medical officer of health. They can find her the army what is the hospital for her to be admitted.
Right, and children. This is also a question, mothers who have infants, young children. How does that work here? Because mostly we see, I mean, even during, in a normal situation, we see a lot of children at hospitals and pharmacies for mild cough, for mild fever, because the parents fear. But in these simple cases, sometimes they can't go out during curfew times. But then again, authorities have ensured that emergency situations are allowed. But how do you advise parents? I mean, do they have to seek medical advice for the mildest cough and fever at this time?
Yes, they should. If they have fever and cough, they should seek medical advice, because they are small children. So you can't be keeping at home. But if you can see that it's very mild, with mild fever and all, you may give certain medicines what she has been used to give or he has been used to give. But otherwise, it's good to inform the health authorities again, provided that they have a history of having had contacts with someone who have come from overseas. But that kind of information is also needed. I mean, just because you've got a kind of mild respiratory infection, of course, you don't have to run to the hospital. But you can always ask the public health midwife and the MOH.
Right. The second day where no cases were reported in Sri Lanka. So finally, I would like to end on that note. Where do you see, do you think all our efforts would be able to beat COVID-19 in Sri Lanka? How prepared are we now at this stage?
Yeah, so the preparation, of course, as we all know, I mean, we started from the points of entry, and then, all these kind of different quarantining, contact tracing, and then providing and kind of, I wouldn't use the word lockdown, but the thing is that kind of, the curfew also has been imposed to reduce the movements of the people. And so various measures have been, put in place to achieve, the target that we don't want COVID-19 to be spread in our country. I mean, that is the final aim of all of us. So in the Sri Lanka Army, the police, and many other organizations are helping the health authorities to prevent or this being spread over to the community. So that our final goal is, we want to somehow or the other, curtail, and to bring down the incidence or the number of cases in our country. Of course, today and yesterday, of course, we did not have cases, but there may be a few cases that are coming up because there may be patients who have been having contact with.
They may develop symptoms.
May also develop symptoms. So that is what is where we are looking for. But we should be able to reach the target of course, prevent COVID.
From Sri Lanka. Thank you very much, Dr. Palihawadana, and we salute all your efforts throughout all sectors that in Sri Lanka who are engaged in emergency services. So once again, thank you for taking the time to join us here at our studios at Hyde Park. We had with us Dr. Paba Palihawadana, Deputy Director General of Public Health, who's also ensuring that the epidemiology side of public health is addressed as part of 10 areas that she's overlooking. Thank you for joining us at Hyde Park tonight.